I have the privilege today of introducing Paul Conway. Mr. Conway is Chair of Policy and Global Affairs, American Association of Kidney Patients, or AAKP. Mr. Conway will be presenting on Navigating COVID-19, how kidney patients have taken responsibility to protect themselves. As a kidney advocate, Mr. Conway serves as patient voice editor for the Clinical Journal of the American Society of Nephrology. He is also member of the American Board of Internal Medicine's Nephrology Specialty Board. His previous federal posts have included Chief of Staff of the U.S. Department of Labor, Chief of Staff of the Office of Personnel Management, Special Assistant in the White House Office of National Drug Control Policy, and Confidential Assistant at the Department of Education. Mr. Conway, you have the floor. Thank you.
Thank you very much, Dr. Kavanaugh. And by way of background, my interest in public policy and health issues crosses not just on kidney disease, but in other areas. And I had the pleasure to meet Dr. Kavanaugh through my role. I serve as a liaison for AAKP to the Health Infection Control Practices Advisory Committee, HICPAC, of the CDC, and I've served in that role for 6 years. And so what I want to lay out for you are a couple of different things about why we've been concerned as a national advocacy organization. And myself as a patient, I'm a 46-year kidney patient. I'm 26 years out on a kidney transplant. And when you see the different news stories out there about high-risk patients, I am in that category, as are many of our members. It took 3 shots of the vaccine in order to register any antibodies with me, given the immunosuppressive load that I'm on. And like a lot of patients, we don't just have a kidney issue or a transplant issue that we manage. Many patients also have heart issues and endocrine system issues and many other things that they're afflicted with, including things like diabetes. But I wanted to go ahead and give a snapshot of information here about what we've done working with the patient community and allied organizations to raise awareness, because there's an old saying in disaster management: if you're waiting for the government to come, you didn't prepare well. And so we have a perspective. We've been around since 1969. We're the largest kidney organization in the US, of we need to lean into any issue that's emerging and own it. So one of the best data sources in the United States for kidney patients is actually run out of NIH. It's the United States Renal Data System. It is a source for many of the researchers around the country in the academic settings, and it is also a great source for government policy development. And one of the things that you'll hear here tonight is how stunned we were with some of the guidance that was coming from CDC, because it was unusual in its lack of clarity in what we felt was ignoring data. So just to give you a sense of where COVID hit for the patient population, kidney patients, you can see some data on here. Probably the most important things to keep in mind is the comparative impact against other Medicare beneficiaries. And you can see it right here. 10% of the patients with CKD, 13% of the patients with a kidney transplant, and 20% of the patients on dialysis were diagnosed with COVID-19 by the end of June of 2021. Because you always, as you folks probably know much better than I do, there's a data lag. But take a look at the sub numbers here. That's 50%, 100%, and 200% higher than other Medicare beneficiaries without kidney disease. The hospitalizations were more than double among patients with kidney disease compared to those without. And this is probably the saddest point: mortality rates. This has gotten some news, not a lot. We're nearly twice the rates compared to those without kidney disease in the United States. I'll leave the other data on here for you to take a quick look at. The last point is probably the most sobering one. Traditionally, or historically, in the data sets in USRDS, you can always see the disproportionate mortality numbers among minority Americans. And people talk about issues about healthcare access and opportunity. And, are these things real or not? When you're a kidney patient, you know for a fact that disease disproportionately impacts minority communities. It is a reality. It is a killer. And it only got exacerbated even more during COVID. Essentially, so many people died that it reduced the mortality difference in the populations. And this was a subject of great interest to the University of Michigan, which does a tremendous amount of research. They actually published a paper in October of last year indicating that the 2 highest mortality or 2 highest impact populations of COVID were dialysis patients and transplant patients. So in March of 2020, we were very involved in monitoring where things were going with COVID very early on. We started patient education campaigns, and we use a lot of high impact graphics. I've got a background in political campaigns. The way to catch attention on social media is to do these types of things, memes, and then it drives people to information sources or webinars. So we would use a lot of things like this. At that point in time, we were using a lot of the CDC data to highlight the concerns and the risks to patients. And then we did a tremendous amount of survey data, and we continue to do survey data. Our data sets are usually in the range of 8 to 1,200 to 1,500. A lot of our survey mechanisms are used by the federal government, many different federal agencies. We use pulse surveys, which are kind of quick hits. And then we do a lot of surveys for more substantive research and research grants for NIH. But we decided to go out and ask this question at least twice a year. This is our latest data pull from December to January of last year. And I'll make a point at the end of all these slides to give you a sense of where we are now. But for impact around close circles of friends, 83% indicated that they knew people. And these are dialysis and transplant patients. 83% knew people who had gotten COVID-19. And then we asked, what are the mitigation strategies you're taking? And so as I've talked about this, patients have a great sense of standing up and being responsible for themselves. And you can see here, 84% vaccination, 81% wearing masks, the hand washing, all the different guidances that were given out from expert sources, patients were following those. The online shopping number is quite interesting because in our view, that tended to highlight the fact that many of our patients live in areas and do not have access to internet services. And so they were still taking risks. But you can see from these other things that were within the span of control, people were trying to do the right thing. We posed this question, which we thought was important, about the emergence of new variants. So we're asking this question essentially last year in the fall. We're out in the survey again this year, the same questions. But in terms of looking at stuff, are you more concerned or less concerned? More concerned is 35%, less concerned 47%. Last fall in the December and early January, this is where you're starting to see kind of the turn in messaging, we think, in the media and online about, hey, the risk is being reduced. It's not so much of a problem anymore. You can see how that gets picked up even in our population. And then we always ask a question because of the level of exposure during travel in airports and on planes and that type of thing about traveling. And so this is data now looking at in 2022, asking folks, what do you plan to do? And, we've got 20% of the people saying they might travel more at that point in time, 31% saying less, and 40% about the same. And when they're saying about the same, what they're saying is basically they're saying home, because that was what the data in 2021 and 2022 was showing. And so then this is a question that we ask to get a sense of people's confidence in government and media. This was very interesting because we pushed this really hard across immunocompromised dialysis patients and immunosuppressed transplant patients. But you can see in terms of how they felt about the general public being concerned about them, very low numbers, only 16%. They thought the general public would care about what their concerns were as a patient group. The media, very little, less than 20%, thought that their concerns were being reflected in the media. The federal government at that point, there was a feeling that only about among 30% of the patients that the federal government had them as a priority. State government, even less, as you would expect, I think. And local government, even less than that, nearly half that of the federal government. So this is at the period of time where everything's starting to reopen. From our standpoint, we took this as our charge to expand radically the amount of information programming we were doing out to patients as a trusted source of information. And so this is us asking, as public vigilance drops, do you feel an even greater need to take care of yourself? You can see there the number's pretty stunning, 85%. This is in a data set of about 1,200 patients. You got 85% of the people saying, I need to defend myself. There are not too many other people that are doing it. And then this is pushing on the question and testing on the question of vaccinations. Do you think if it got routinized to the point that it's almost like an annual flu shot, would you still participate in it? And you got 72, almost 80% saying yes or likely that they would, which is fantastic. The good news is we've been adding this in surveys over the past several months. That has not dipped, which we think is important as the new vaccine comes out this week and next week, that we do think that our patient population will seek access to it. We were very pleased to see the news that Dr. Kavanaugh pointed out about increasing access and removing the barriers to it. It's absolutely a sign the government's got a concern about it, and our patient population, along with others, has to get in there and get it. We're confident that they will. And then another question on variants. What types of activities will you stop or decrease? Recreational travel, very high. People understand that their exposure to COVID puts them at risk, especially the behaviors of other people, in-store shopping, and social activities. And so to us, this is a good baseline of data about the alertness of the population and their resilience in the face of disinformation, whether it's on the media or on social media. And it's an opportunity for us to keep our programming going. So I mentioned that at the June meeting of the CDC's HICPAC, they talked about a set of guidelines that essentially they had adopted absent public comment at the front side of the process. And they were putting these things out, and the discussion was about mask efficacy. And in our view, sitting there and watching this after working with CDC for many years during COVID, we just thought that the messaging was 180 degrees contrary to what common sense was and what was best in terms of patient-centered approaches to protecting the most vulnerable. And we stated it. As a HICPAC liaison, what you're obligated to do is then put your comments in writing and submit them for the minutes. And I know that Dr. Kavanaugh and others always pay attention to HICPAC minutes. But I want to read you a sentence that we added to that report that we submitted, because it's highly unusual for us to comment in any way that's negative about the federal government. We're reluctant to do it, but sometimes we feel like we are obligated to do it. This is the last sentence that we added. We believe that HICPAC made a serious mistake by voting on this issue before public comment. This is an avoidable and self-inflicted injury that has further undermined an already weak level of CDC credibility and has put the incoming CDC director at a severe disadvantage with kidney patient advocates. That sentence was not included in the minutes when they did the summary notes, and they were published last week. Not a surprise, but we were using that report to send a message of how incongruent their June meeting was. In May, when the national public health emergency ended, our organization actually issued a public statement called Ending the COVID-19 Public Health Emergency. Don't forget kidney patients, their vulnerabilities remain. And in some of the issues that we identified 6 areas in addition to ongoing mitigation and prevention. We identified 6 areas that we thought that the federal government should concentrate on with CDC and outside CDC. One was to align regulatory and payment policies for vaccine innovation. 2 was to foster innovation in transplant drugs via the FDA immediately, because a lot of the drugs are considered high dose, not necessarily the best dosing. Formalize telemedicine flexibilities that have been used by patients during COVID. Expand home dialysis options so that more patients can get dialysis at home and not in a center that's afflicted with high incidence of COVID. Protect the rights of kidney patients under the ADA, and expand data transparency and access to researchers and patient advocates and elected leaders. Because you had a situation for a while where the data was so bad during COVID that some of the data reports and analysis were not made available. The data sets were not made available at the facility level. And we found this very troubling because a patient couldn't figure out what is the highest risk center and is mine one of them. We found that absolutely unacceptable. And then the other thing I just wanted to point out, and then I'll stop here, is our efforts with CDC are typically collaborative. And so while at the same time we're having a disagreement with the HICPAC, even today when we reached out, CDC has launched a new effort to do surveillance data for kidney patients across all populations, especially minority populations, on the prevalence of kidney disease. So today at our national meeting, we had the CDC presenting data on current risk of COVID and research. And what was fascinating to us is here you have a June meeting saying, okay, for the most high-risk patients and the highest cost patients to Medicare, we're not going to be proactive and recommend masking for the people that are around them. But at the same time, today they were presenting data on what a remaining risk and how great the risk is to those who are most vulnerable in dialysis centers and transplant. So it's one of those things where you keep up the collaborations. We collaborate with DoD, with the VA, with FDA especially, and with NIH. But every now and then you get these things that happen that you just have to call out and say, your inconsistency, what we term government inconsistencies like this as, we call them government determinants of health. When the federal government issues policies that are contrary to the best interests of a patient population, we don't mind saying it and pointing at it and acting for change. I'll stop there if folks have any questions.
Let me ask at least one question, Mr. Conway. Given the uptick in COVID variants, could you tell us what the AAKP is doing to educate patients? What are you telling your patients to do to protect themselves when they go into the healthcare system, given really the lack of adequate protection that the healthcare system is providing?
Doc, it's a great question. So to date, we've done over 24 webinars. We have high attendance. The first webinar that we ever did, COVID, had over 8,000. It kind of blew up our system and we had to change the platform that we were using. But what we're recommending to patients is be proactive. Sometimes it can be contrary to the instinct of a patient, but we're telling patients to tell their medical professionals if they're not comfortable and to mask. I'll give you an example. I don't get out much as a transplant patient. I needed to do an eye exam, and I actually brought 2 sealed N95s with me to the eye doctor to make certain I could ask the question, hey, do you mind masking? I have a transplant. I'm trying to maintain it, and I don't want to get sick. And they were a great office. They said yes. The reception person said yes. The tester said yes. It sounds like it's going to an extreme, but we're recommending that patients really, really prepare themselves, follow whatever the data they can. If wastewater is the best data, follow that data, ask tough questions, and push hard to make certain that the professionals who are responsible for caring for them are actually protecting them. I got to tell you, it's so backwards. I mean, the onus shouldn't have to be on the patient in a medical setting to push for protection, but that's where we are.
I agree 100%. And thank you very much, Mr. Conway, for your insights and for this excellent presentation on a very urgent and pressing medical issue.